Hello, everybody, and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin. And as always, I'm excited that you're here. And we have a phenomenal guest today. As in CDA, RDH, Ann-Marie DePalma has dedicated her life to educating all dental team members with a diverse lineup of continuing education topics, as you'll hear about in a little bit. Having a master's in education and fellowship in numerous professional organizations, Ann-Marie has been a published author for several dental and dental hygiene publications. Her interest in technology has grown over the years as technology has changed the landscape of dentistry and dental hygiene. Obviously, a topic near and dear to any listener to the Patient First Podcast. So, Ann-Marie, thank you so much for joining us on the podcast today.
And thank you, Bryan, for having me. And welcome, everybody. I'm so excited to be talking with all of you, meeting you at some point in person.
You have a diverse background, as you mentioned in your bios. RDH, CDA, Master's in Education, and then wrapped around this background in technology. So can you talk a little bit about your background and how you got where you are today?
Thank you, Bryan. Basically, what I've done is I was a hygienist in clinical practice for a number of years. I practiced both in perio and in general practices. And when I was in hygiene school in the dark ages, I swore that I would never work in a perio practice, but that's where I spent most of my clinical career. And then I had the opportunity to become part of a dental hygiene program and became a faculty member and also involved in a dental assisting program. So I have a background in clinical as well as in academia. And then over time, life changes, and I ended up working with a large dental vendor as a trainer, software trainer, learning about their software product and training other offices about the product and training in transition, in updating, in all of the technology that comes with their practice management software. And then again, life changes. And I ended up working for a company that deals with artificial intelligence. So I've always been part and educated and excited about technology. Now, over all of my career, I have been presenting CE programs as well as writing, as Bryan mentioned, for continuing for dental and dental hygiene publications. But after I left that AI company, I decided that I'm going to really focus on the education piece. And all of my educational topics are geared toward dental team members, whether that be learning about their technology and how that's used in their practice, or elevating their own perspective in a variety of different ways.
That's interesting. So when it comes to the educating dental teams about technology, what do you think is the low-hanging fruit for practices when it comes to learning about technology and how to implement it in their practices?
First, the team has to be involved, regardless of whether that be simple as or not simple as changing your practice management software. That's a challenge. To adding some new imaging or other types of new technology, whether that be CBCT or AI or anything that's out there. Having the team involved is number one, because if not, then that whole change process and the inner 2-year-olds come out. I don't want to do this. Don't make me do this because I'm not involved in the stake of why we're doing this. Just think about patients. And when you give them a treatment plan, they may be saying, no, I can't do it. No, for whatever reason. Their inner 2-year-old comes out. And we have to deal with any objections that they may have. So talking to the team about objections and getting those out on the table is so important.
This is a topic that I'm very passionate about myself, because I do believe, like you're saying, it's crucially important to involve the team. But I've not met a dental team that doesn't involve somebody that says no to absolutely everything that's implemented in offices. Typically, when we're talking with offices, we recommend having a champion for every product. So somebody that's in charge of making sure that the implementation of a technology is successful and handling those objections. My personal philosophy is not as much a democratic, let's hold a seance and see if everybody agrees, because there's always going to be something, even if something is better in every single way to everybody, there's going to be people that don't want to do something new, right? So how would you recommend crossing that chasm with team members?
The negative Nelly that there's always that person on the team, regardless if that's technology, like you said, or something else that you're bringing, a new product, a new way of doing a composite, for example. Having that champion is so important. Getting that one person on the team or two people on the team who really understand what that new product or new technology is about and how it's going to help the number one priority in any practice, and that's the patient. Yes,
Yeah.
whenever you learn anything, it's going to be a slow learning curve. But as you get used to it, many times after we did a training, conversion training with the software, we would hear, oh, this is so much better than our old. Why didn't we do this before? But having that champion helps elevate the whole team to
Yeah,
get to that point.
totally agree with you. Obviously, it's called the Patient First Podcast based on my book. Normally, there's a big sign back here, but I was doing a webinar, and I don't think it's inconsequential to align with your team that it's in everybody's best interest to put the patient's needs first and to have a patient experience. Because there's a lot of dental teams that I see that don't actually understand the value in putting the patient's experience, the patient's perspective first, because that's where everything else flows from. So I like how you tied that all back to the patient's experience. I want to switch gears a little bit because you're focusing right now. Like, we had an interesting conversation at the Yankee Dental meeting in Boston where you're talking about your focus on women's health. So could you talk a little bit about what you're doing in that?
As we mentioned before, I have a diverse lineup of topics that I do. And all of my programs, as I mentioned, are geared towards the team, but they come primarily from experiences that I have had either as a woman or as a mom or as a patient. For example, TMD. I'm a TMD patient as well as a hygienist. And over the years, all of those courses have evolved and changed. And now I'm focusing on women's health. We know that women make up 37.5 million people within the United States. So there are so many women and there are so many diseases and conditions that affect women that, yes, we know about, but there are others that we don't know about. Things like polymyalgia rheumatica, things like TMD and relationships to estrogen, and a number of other skin and in systemic diseases that we've never heard about, but they affect our patients and their oral health. And because of all of these different conditions, there may be medications that the patient might be on that those affect their oral health. So all of these things have combined into one program that offers an insight into some of these unknown conditions, under the radar, I call them, under the radar conditions that help women understand and go through whatever they are going through.
It's really interesting because I personally had more than my share of CE, and I haven't seen programs focused on women's health in dentistry. And it's a little shocking when you brought it up to me. I was like, I can't believe that this hasn't been a focus area previously. So how did you basically just said that you came about this through your own experiences, but are you seeing other practitioners? Are there other people that are getting involved with this movement, or are you banging this drum yourself?
So there's a lot of programs out there that focus on the 3 times in a woman's life where hormones affect their lives. Puberty, now the pediatric courses, pregnancy, we know about preterm low birth weight, and then menopause. And there are a number of people out there that are presenting programs on menopause and women's health in general. But I look at it from a perspective of, yeah, those are all great. We know that the mouth is connected to the body. But did we ever hear of a patient coming in and marking their medical history and how important that medical history is? And you noting something there that you've never seen before, things that are out there. As a patient myself, I came across, when I've mentioned my conditions, I've come across so many people who have said, "Oh, I have a relative who has that," or "I've had that," or "I know other people who have experienced it." But it's under the radar. People don't
Yeah,
realize that there's things out there.
if I was still in clinical practice, this is certainly a course that I would take and bring team members to. I think that it's such an shockingly under highlighted aspect of dental care that I think needs to be highlighted. So I mean, I very much applaud you for championing this, because I mean, I can't believe that this hasn't been brought to the forefront of dentistry. That women's health has been, you know, unless in dental school I learned about certain conditions related to pregnancy, and that's pretty much it, right?
Right.
So I think it's very interesting, and probably dentistry. I was just talking with somebody today who says dentistry is 20 years behind medicine. And this is probably one aspect of medicine where we are 20 years behind, similarly, maybe a little more. Um, so I think it's important for the people who are listening to this podcast to learn about women's health and dentistry. Where can they go to find where can they go to find out more? Not just about, obviously, you talk on a diverse range of topics, but where can they find out more to learn what you do? And I think specifically the women's health issue, I think, is just a massive concern that everybody should pay attention to.
Exactly. Thank you, Brian. Two places they can reach out to me. They can email me, DePalma Ann-Marie at gmail.com, or my website, depalmaannmarie.com. So those are the ways I have connected with a number of people, as well as on LinkedIn, Instagram, and the social media sites and all of that. But those are the two main that are the best ways of getting in touch with me and learning more about what I do and how I can help teams and groups and organizations with learning about all of my topics, not only women's health. And this is where I love our connection, Brian, because you're so involved in understanding that overall connection. The mouth is definitely connected to the body, and having something like Toothapps brings that into real focus, because it's not just here's the mouth, here's the body. We need to bring them together.
Yeah, I totally agree. And obviously you understand that too. This idea of having interoperable or connected medical and dentistry without, importantly, maintaining the autonomy of dentistry. I think that's as important as having connections between medical and dental is maintaining the autonomy of dentistry. Not mainly because it's not like things on the medical side are all figured out, right? I like to say we're messed up in different ways. Yeah.
I volunteer at a local hospital, and I had a conversation with volunteer directors the other day. And I asked if they knew of anything that a hospital had in terms of oral health. And they both gave me the same look. No, we don't know. We have to find out. We don't even know if there's anything that exists. And I'm like,
Yeah.
good, let's talk. I know a little bit about that. So let's figure it all out. We'll see
Yeah,
where it
it's
goes.
it's an important topic that we are doing. Obviously, I think both of us have a heavy focus on right now. I think meaningfully connecting dentistry and medicine. I think the first step is connecting dentistry. Dentistry right now is siloed and problematic. So we can't connect to medicine. When a lot of dentists raise their hands and say, why can't I connect to the physician or the oncologist? And say, why can't you send an x-ray to the endodontist? We have to solve the problems at home first, I think. And frankly, it's the same problem. Like whether or not we're connecting dental practices, connecting dental patients, or connecting to a physician, it's all the same issue. Just meaningfully connecting our information so that we can pass the baton and everybody can have transparency into what's going on, right?
Yeah.
And
I love that you mentioned silos because in a couple of my programs, I do have pictures of silos that we talk about within dentistry. There's so much information that we have that doesn't talk. So I love that you first want to deal with dentistry and then beyond. I love that.
yeah, and I think that, again, it's all the same issue in my mind, and at the center of it is the patient, like we talked about, right? Because very importantly, having the patient have access to their information, transparency into what's going on, because there's only one party that's going to be going from the general dentist to the surgeon, to the physician, to the oncologist, back to the surgeon, that's the patient, right? And so having them at the center of their care, I think, is key. And so again, I'm going to re-emphasize what I said before. Make sure to we'll put a link around this podcast to go check out Ann-Marie's presentations and all the great work that she's doing. Ann-Marie, thank you so much for what you're doing for the profession and how you're helping everybody in dentistry. Appreciate it.
And thank you, Bryan, for everything that you do. And thank you, everyone, for joining today. Glad you all have a great day.
Thank you for being on the podcast. So thank you for being on the podcast too. Appreciate it.
Take care, everyone.